Following presentation will identify vulnerability in the Twin Cities to heat stroke. In overview, this presentation will cover the purpose of the project, its background, research questions, study area, heat islands in the Twin Cities, access to emergency services, vulnerability in the Twin Cities, the final map, my conclusions, future research I think would dovetail nicely with this project, and the data sources I used. This project was done for community partners. The purpose is to identify urban heat islands in the Twin Cities, access to emergency services, and to find locations of vulnerable demographics to heat stroke. According to the EPA, urban heat islands are warmer than their surroundings, especially at night, where they continue to release heat even as the rest of the area cools down. It often lacks vegetation, usually being mainly pavement. Buildings and pavement store heat during the day and release it at night. Stone and metal will absorb heat. Dark colors will increase heat absorption, so blacktop or tar roofs will really increase the heat that an area can absorb. Impervious surfaces cause water to run off, so having a bunch of pavement everywhere means that water will run off, it won't evaporate, and less evaporation means a drier and hotter climate. It also means you're going to get more polluted water running off into the groundwater. And heat islands increase heat-related mortality by people never getting a break from the heat, and it continually stresses them and builds up to heat stroke. Distance is very important when it comes to emergency services. The further away a hospital or fire station is, the longer it takes for first responders to arrive to the scene of an emergency. The highlighted text below from Issues in Critical and Emergency Medicine is an excerpt concerning a study from Singapore that showed as the density of emergency services increased, response times decreased, and a rise in the survival of patients occurred. So as the distance between a station and an emergency decreases, that time correspondingly decreases, therefore the patient has a much better chance of survival. If a hospital is farther away, it's harder for people to get there, whether it's walking or driving, and then less people go to the doctor, which means that what could start out as a minor illness builds up because people either don't have a way to get to the hospital or it's just too difficult for them to go there, especially if they're having to work all the time. Vulnerable populations to heat islands are generally a poor population living in a high pavement, low vegetation area, so you've always got that sun being absorbed by the pavement and that heat getting put out constantly. They usually don't have money for air conditioners, so they're always enduring that heat, that stress is building up. They're generally elderly, young, and sick, and consequently they are more susceptible to an unhealthy environment. I have 3 research questions for this project. Where are heat islands in the Twin Cities? What is the access to emergency services throughout the metro area? And where are the locations of demographic groups in the Twin Cities that are most vulnerable to heat stroke? My study area is the 7-county metro area. According to the EPA, heat islands will increase summertime peak energy demand by people always running their air conditioning, and then this causes rolling blackouts because people are taking up so much of that energy. It increases air conditioning costs because the price of electricity will go up. It will affect air pollution and greenhouse gas emissions because all that electricity is needed, so the power plants need to start producing more energy. Heat-related illnesses and mortality increases because there's just this constant bombardment of heat, and people start getting heat stroke or heat exhaustion, and they start dying. Water quality decreases with large amounts of runoff from impervious surfaces because it quite often picks up pollution or garbage, which then sits in the water and pollutes it, and then it runs off into the groundwater or into the lakes and rivers. It may benefit the community in winter by providing a warmer climate, but overall it's very bad for the environment and the community. This is the model that was used to make the urban heat island map. So for that raster calculator number 2, the equation used was biomass, so basically like the green vegetation, minus impervious, so it's double weighting the impervious layer, impervious being pavement, plus reclassified water, that's just lakes and rivers in the area. And then reclassifying that urban heat island is just reclassified 1 to 100 to standardize it so it could be fed into another raster calculator with other rasters. This map details urban heat islands in the 7-county metro area. You'll notice that the majority of the 7 counties are yellow or medium heat. This is rural areas for the most part, or otherwise unimproved, not paved. The green areas are the waterways. You can see the Mississippi and several lakes outlined in dark green. And then the red concentrates on the built-up areas downtown. It follows the highway system. You can pick out roads in there. This map shows the locations of hospitals and fire departments in the 7-county metro area. This map shows the friction of distance in the Twin Cities, or detailing ease of travel throughout the 7-county metro area. The low friction areas, or the areas easiest to travel in, are shown in white, so you can see the highway system is detailed in white. And the red areas are the hardest to move in, so these would be the rural areas because it's smaller, twistier roads, or you have to walk. The exception are the dark red areas, which are the waterways, as travel by boat wasn't considered, so the computer just considers those to be the most difficult travel in the 7-county area. This map illustrates how 2 places can be geographically close, but due to the difficulty of travel, may require a great effort to travel between the 2 places. This slide will explain how the cost distance tool works. I'm going to be using this tool to make a map showing access to emergency services through friction and distance. So the input data can be a raster or a feature class. If it's a raster, source cells are all in the raster that have valid values. If it's a feature class, the source locations are converted inside the tool to raster. The input cost raster will intersect with the input data, and the output is the intersection of the 2 rasters. The maximum distance defines how far out the tool will go from the input raster when finding intersections and distance. This is the model used to make the access to emergency services map. We start off by merging the fire department and hospital maps into one, so that way it's just points listed as emergency services. This simplifies the process. We then combine our friction map and our emergency services together, so now we are looking at friction of distance as applied to emergency services. The output of the cost distance tool is the cost distance to emergency services. We then reclassify it again 1 to 100, and that gives us a standardized cost to emergency services map, which we can then feed into raster calculator with our other maps, putting it towards that final map. This map shows the access to emergency services using the cost distance tool. So in this map, the blue areas are low difficulty to transit, so you can see the highway system is laid out in blue there. That's because it's the least friction of distance, it's easiest to travel, you have the quickest response times. The highest difficulty to transit is in red there, so you can see as you get out into the rural areas and on some of the waterways, it is laid out in red as it's more difficult for humans to travel. On this slide, I've laid out the emergency services map and the cost distance of emergency services side by side, so that way you can do a comparison. You can pick out on the cost distance map, those points of blue correspond to emergency service points in the emergency services map. This is the model that I used to create the standardized vulnerability map. I start out by taking American Community Survey block groups and 2010 census block groups and identifying the percent no high school, the percent of the population over 65, the percent that are rent burdened or they're putting a significant portion of their income towards rent, the percent English speaking, the median age, the percent white, and the homeowner percent, looking at that ratio of renters to homeowners. All of these are then reclassified 1 to 100, and that's where we get the standardized title on that output. They are all then fed into raster calculator, giving us a map of vulnerability in the Twin Cities. We then reclassify it 1 to 100 once more, giving us our standardized vulnerability map. The vulnerable areas in the Twin Cities. The areas that are red are most vulnerable to heat stroke. This corresponds with the urban heat island map shown earlier in the presentation. The vulnerable areas are largely concentrated in the city's centers, although there are several outlying block groups. The green areas are least vulnerable to heat stroke. They are wooded, open, or rural areas which are not as built up and don't have masses of pavement and urban canyons radiating heat constantly. This is the final model. As you can see by looking at it, the three previous models you have seen are now combined and they are fed into another raster calculator, which is then run, and we get isolated, hot, and poor, our final map. This is the final map that combines the previous three models and maps you have seen. Urban heat islands, vulnerable demographics, and access to emergency services are all combined in this map. The red areas are most vulnerable, and the green areas are least vulnerable. By looking at these maps, we can tell that heat islands are concentrated in the center of the metro area, in the downtowns, and Frogtown. Access to emergency services is fairly good in the areas with heat islands, which will help to save lives. And from looking at the models and the EPA's website, we know that old, young, sick, and poor people are more vulnerable to heat stroke. According to the EPA, some of the following methods are ways to mitigate heat islands and make your community a healthier, safer place to live. So you want to increase vegetation in the area. You can do this with green roofs, just having vegetation on roofs, sidewalk planters, sidewalk trees. Use heat reflective colors like white, not black. Use non-heat absorbent materials for buildings. Cool roofs using special materials to reflect the heat, keep the roof cool. Minimize runoff and utilize that water. And have open spaces. Don't allow buildings to be close enough to where they're just reflecting heat back into each other and just perpetuating the heat island effect. Some future research I would like to do pertaining to this project is looking at how runoff, whether it's polluted or not, from the impervious surfaces of the city affect the health of the population. And also, how closely do food deserts, or areas where you can't easily obtain healthy fresh food, correspond with heat islands.